Joining us today is Dr. Alison Chiu, one of the ophthalmologists at E4 Health, and today we're going to talk a little bit about pterygiums. Now, in Australia we have a lot of pterygiums. Tell us a little bit about what is a pterygium and where they are on the eye.
So pterygiums are basically sun-related damage on the eye.
Yeah, I was going to say, where's your little eye model, Alison?
I've got an eye model.
It goes with you everywhere.
And they occur on the white of the eye, usually in the inner or the outer corner. And the reason why is because the incident sun rays come through the cornea, which is the clear window of the eye, and it sort of acts like a magnifying glass, concentrating those sun rays on the white of the eye next to it. So the sun rays just cause UV damage to the cells, and there are special basal limb cells surrounding the cornea, which normally keep the white tissue of the eye off the cornea to maintain our clear vision. The damage from the sun rays breaks down the normal function of those cells, so it allows the conjunctival cells, the cells on the white of the eye, to start growing over the cornea.
And apart from the fact that it looks cosmetically unsightly, do patients complain of any particular symptoms with pterygiums?
Yeah, so one of the most common symptoms is discomfort. So that can be dry eye or a grittiness in the eye, or the sensation that there's sand or something in the eye.
And are any topical treatments, meaning drops, that you can put in to manage that, or is it preferable that you just, what would you do if you had those symptoms?
So the first line treatment for a symptomatic pterygium that's causing dryness or grittiness is to use preservative-free artificial teardrops to lubricate
just to lubricate it.
Yeah, because there is a disruption of the tear film with that irregular surface. So the artificial teardrops will help regularise the tear film. Often people go through seasonal flare-ups with their pterygium, so in that instance we can sort of judiciously use some topical anti-inflammatory drops to help with the symptoms. And actually problematic symptoms that are not responsive to those more conservative management of drops are then suitable for surgical management for removal of the pterygium.
What is pterygium surgery actually involve?
Yeah, so first of all we need to arrive at a decision first about surgery being the best decision. So the indications for surgery are problematic symptoms that aren't resolved with conservative management. The cosmesis or the appearance of the pterygium. Yeah.
Does it have to go over a certain part of the eye, or that it can be cosmetically unsightly even if it's minor to somebody?
Yeah, it can be cosmetically unsightly even before it's grown over the cornea, in which case it's actually called a pingueculum and not a pterygium. But even some
that's
people,
hard to say. Pingueculum.
Even some people find those unsightly in appearance. The other indications for treatment are blurred vision, and that can be twofold. First of all, if the pterygium is large enough, obviously, it can grow over the centre of the vision and block the vision. Even if the pterygium is small, it can blur the vision because it has a pulling effect on the cornea, so it changes the refractive properties of the eye. So those are the indications for treatment. In terms of the actual surgical treatment itself, what it involves is excising the pterygium, so taking that abnormal tissue away, preserving the corneal tissue that's there and making sure that the optical surface is smooth. And one of the mainstays of current treatment, which is really important in terms of decreasing the recurrence rate, and that's really important because recurrent pterygiums, when they come back, tend to be much more aggressive.
Oh dear.
So what we do routinely now is to take a graft of tissue from underneath the eyelid and place that over the site where the pterygium has been removed.
Okay. And what's the relapse rate sort of tend to be?
So pterygium removal that's done in conjunction with graft, that has been shown to decrease the recurrence rate from about 15% to 1%.
Wow, okay,
cool.
So
it's really significant.
Cool. And in terms of the actual procedure itself, is it just a day procedure, or what can people expect with that procedure?
It's done under local anaesthetic, so the eye is given an anaesthetic so it doesn't feel any pain, and so the eye can't move. The pterygium is excised, the graft is done, the patient goes home with a pad over the eye. That pad stays in place overnight until review the following morning. And routinely eye drops such as anti-inflammatories and antibiotic eye drops are used for 4 to 6 weeks after the surgery. And after the surgery also, we can prescribe painkillers if required. It can be quite uncomfortable after the surgery. There are two main techniques of securing the graft. One way to secure the graft is with sutures, that's the traditional way. A newer way to secure the graft is with a tissue glue, which is much more comfortable for patients.
Excellent.
Yeah.
The other thing I wanted to sort of draw attention to is I've noticed that a lot younger people seem to have pterygiums than when I used to previously think it was just for the oldies, but I'm seeing a lot of young people. Is that a trend? And also, how would you think that Australia rates with pterygiums as opposed to other countries?
So the rate in pterygium is quite high in Australia. It's related to the warm climate and exposure to UV rays.
Yep.
And just like we know with skin damage from UV rays, that damage is done to the eyes usually in people's childhood.
Wow.
Yeah.
Okay. And so, is this a case of wear sunnies?
Broad-brimmed hats and sunglasses and general sun protection measures that you would take for your skin. Yeah.
Thank you for joining us, Dr. Alison Chiu.
Thank you.